Welcome you all for the health station meeting today. And this is our mental health month for the meeting. And we are alternating between mental health issues and physical health issues instead of having both on the same day. For today, we have chosen a topic that has been a common question asked for all the mental health professionals. Whenever there is a problem with a family member or within a family, they always ask, how can I approach the person? How can I get help for the person? How can we persuade the person to get help? And everybody's worried, and nice thing is people care about each other. People want to help each other, but they have a hard time getting the help or getting the person to the helping professional. Therefore, I thought this would be a good topic for us to learn and hear from. And fortunately, we have Dr. Shastry in our community, who is very busy in his schedule, and he's gracefully agreed to come and present us on this topic because he has the widest experience in dealing with people who may be half willing, unwilling, or has to be forced to get help in whatever situation they're in. And in Nashville psychiatric community, he has the most experience. He comes from Bangalore Medical College, and he has his postgraduate training in University of Maryland, and he has his addiction training in Vanderbilt. And he's been in this area almost 30 years, and he's been directing a hospital in Skyline Madison campus in North Nashville for the last 20 years. He has special expertise, in addictionology, but also he's board certified in both, and he has even been a board examiner, and he's been an extensive researcher over the years. Therefore, we don't have any hesitation in trusting him with this topic and help us understand what are all the techniques that he uses to get people to help, and how can we trust that the process works, and how can we go about it when we have problems within our family. Without any further ado, I'll ask Dr. Shastry to take over.
Thank you, Ved. First of all, I want to congratulate the task that you and Pramod have taken to pursue this, especially the health station. And I've heard some really good things. I have attended some. It's going really well. That's a great task that you undertook, and it's going good. And I want to thank the Hindu Temple for giving me an opportunity, and obviously Uma, Ved, and Pramod for letting this happen. That's very glorified comments, Ved. I appreciate that. I don't deserve it, but I'll take it. So I've practiced psychiatry for a while. Prior to coming to US, I was practicing in Jamaica, and then I did some practice in Barbados as well. Then I came to Maryland and did my residency and came to Vanderbilt, like Ved said, about 30 years ago. This is an excellent topic, and this is something that we have struggled with for years, not just in the Indian community, but also in the American community. I can tell you one thing though, the number of families, Indian families, who are trying to get their families to come and see psychiatrists has increased tremendously, because I do get a lot of calls, and a lot of the people I get the calls from to just have their family members see me are known to me. So I really don't want to kind of just get involved too much, but I'm able to send them to other physicians for further treatment. So that's been helpful in that. And Ved, I know, I appreciate Ved helping me with the slides, because it's such short notice that I didn't have a lot of time. But this week I was busy with some injuries and all that, but Ved helped me with a lot of the slides. So the topic of persuading the unwilling. How do you define something? How do you define persuading somebody? It's very important to understand in our culture. If I'm talking to just the Indian community, we have to look at our community, the family structure, the nuclear family. And if you look at what happened 50 years ago in India, I'm not joking. I saw a lot of patients who a lot of people in India, family members or otherwise, when we were growing up, even those days when I was 12, 13 years old, even when I was not even in medical school, I was able to understand that this person is not normal. His behavior is not normal. The way people treat him or her is not normal. So there was something different about this particular person that we were able to pinpoint, say, this person needs more help. It's not medical for sure. I don't know if it's behavioral, mental, but those days, everything was kept quiet. The families took care of it. Nobody really wanted to go to a psychiatrist. I'm talking about mid-70s when we had rotation, one of the best hospitals in Bangalore, NIMHANS, the best. In fact, there are so many well-trained psychiatrists from that particular institute, from both neurology, neurosurgery, as well as psychiatry, very well known throughout the world. And I know a lot of the physicians who are here in this country who trained there. Even when we did rotation, of course, if you're not interested in doing psychiatry in the medical school, you really didn't spend a lot of time. But I saw there were so many patients we could have learned a lot from, even in those days. And then when I did my training in Maryland, I rotated through a place called Crownsville Hospital, which is a state hospital. And the same patients were there for 50 years without leaving the hospital. Finally, they closed the hospital in 1987. That's when all the patients had to be transferred. Otherwise, most patients there were there for years, not going anywhere, because that's what was seen. And I just want to move to the next slide. Wait.
Yeah, bottom.
Yeah, I'm doing it.
You have to do it.
Let me see if I do this.
Yeah, there it is.
I got it. Thank you. So this is unwillingness to seek mental health. What is unwillingness? Because families understand that there's a problem with our children, spouse, parents, or anything like that. In fact, what's interesting, what I have seen more than anything else, is the willingness to get help for elderly patients, especially with cognitive disorders. That has increased quite a bit. And up to a certain degree, I think we are better protected than general population, especially the Indian community and the Asian community, with regards to cognitive disorders. I actually don't do a lot of geriatric psychiatry, but I do know that, our elderly tend to have much less cognitive disorders than the general population. But there's been definitely an increase in getting help to those patients. What is lacking is our adult population. I know Ved is a child psychiatrist, now I'm an adult psychiatrist. The families are willing to get help. I saw a family recently that I did not know in Nashville, an Indian family. They wanted me to see both their children, both boys. They both had severe OCD. One was 12, one was 16. And I said I couldn't see both brothers, but I saw the 16-year-old as an outpatient because they had been requesting it. And I do believe that I know a little bit about OCD than general people. So this particular patient was in such distress, and the family was in such distress because he was almost non-functional. So definitely this generation of Americans, I'm talking about people who came here 35, 40 years ago, and their children who grew up here, are more willing to get help as opposed to somebody who's been in this country for like 50 years. At the same time, they've reached a stage wherein they think that it's okay. And the protection is not just in India, the protection is also here. Look, if you look at the slide, fear of being labeled, fear of being misunderstood and mistreated, that's not uncommon. The stigma has remained the same way for the last 30 years, whether it's culturally, it's not any different. A lot of Ved and I practice in inpatient psychiatry all the time. And the first thing some of the higher functioning patients say is, I don't belong here. They do not belong there because they are not like the other people who are in the hospital. So I keep telling them, you may not belong here, but there's a problem that you need to address. That's what people are afraid because of being labeled. And the other thing is a lot of the youngsters don't want to be on medication because they read a lot of things on Google as to what one of these medications can do. And the next thing you know, they don't take. We have done research, and like Ved was saying, Ved and I did a lot of research, and we did some research wherein we actually were able to monitor patients. 38% of the patients did not even open the bottle. That means less than that, very few people took the medication after they went home. So that's a chronic problem. I'm not talking about a young college student who's depressed or a young college student who has bipolar disorder or substance abuse issues. I'm talking about chronic schizophrenics, general population, bipolar disorder. People don't take medication. That's because they don't think they need it. And even if they took it, once they got better, they stopped taking the medication. And this is a good point, fear of treatment changing the person. If I were to take some medication, what's my personality? What's going to happen to my personality? And look at all the unvaccinated people. I know people who are well educated who do not want to take COVID vaccine because they think that somebody is monitoring them, somebody is going to continue to monitor them. And these are not just people who don't understand what's going on. These are American citizens who grew up in this country. They truly believe that taking the vaccine is going to have somebody be monitoring them. And the one important thing is the loss of custody of children. What happens if I am labeled as mentally ill? I'm talking about general population. We get a lot of patients who have substance abuse issues, bipolar disorder, erratic behavior, legal problems. They come to the hospital. Even the most dependent substance abuse person is scared of losing their children. They may not have had any contact with the children for several months. Somebody else already has a custody, but there's still a rare hope that they may get their children back. They make every effort. They may not be doing it for themselves, but they're certainly doing it for the children. The hope is that I'm going to get my children back. That's an excellent point of losing custody of children. And when you don't have insurance, or just going to the emergency room just to get an evaluation can cost thousands of dollars. Even with the insurance, 20%, 30%, that's enough to really put a dent on your finances. So that's there again. I am going to just pause before I go to the next slide to see if anybody has any questions so far.
It's very common for Indian men to label their wives crazy and the wives to label their husbands domestic violence perpetrators. And both of them have vested interest in getting custody of the kids when they're planning divorce. Any thoughts?
That's a good point. That has increased lately. It wasn't like that 20, 25 years ago. Now, this generation of families are very different with regards to their independence. They want to do what they think is the right thing for the children. And people are always split spouses. I do agree that I'm not talking about just Indian community. I'm talking about general population. I'm talking about America in general. There is this divide among especially middle class and upper middle class, as well as rich people, that bringing law into the family helps them divide and conquer. It's not a good idea. Of course, obviously, you don't know their position. It's easy for me to sit here and say it's not a good idea, but one has to be very careful about making these decisions, because that's going to have untoward effects on the children. Yes, I want to have custody of my children, and you want to have custody of your children. And domestic violence has risen a lot in the recent times, even in our communities. It's so high that I always tell people in Brentwood, if the police come to your house, because I live in Brentwood, I know a lot of the Brentwood police officers, if the police come to your house, somebody is going to get arrested. Please be careful. Think for a minute before you call the police, because one of you is going to get arrested if Brentwood police come. They're like Gestapo. They'll take one of you somewhere. You're not going to be home. So it's a matter of sometimes balancing what's good for you and what's not good for you. And it's not always the easiest thing to do. I want to talk about this slide, unwillingness to get involved. We're talking about people in general. This may apply to an 18-year-old who may say this to your parents. So you, as an 18-year-old in this country, you have laws. You cannot do anything. 18-year-old is an adult. And I recently had a Indian 19-year-old Indian kid who was going to college in East Tennessee. And the one who referred the patient was his father. So, but the kid was very specific. Please do not talk to my father about any of the things I've told you. I respect that because that's what I'm supposed to do. But the father kept calling repeatedly to talk to me, and he wanted to know what the kid had told me about him or his family or what he was doing, some of the substance abuse issues. I said, I can't do that. And this becomes an issue. Even though I'm an Indian, he's an Indian, I just cannot take the liberty. I have to respect my patient and the HIPAA. I did that, and obviously he's a little angry about it, and he left some bad messages on the phone, but that's okay. I'm doing the right thing for the patient. If a patient, and I generally try to persuade the patients, look, that's your dad. I'm not going to tell him anything you don't want him to know, but at least let's touch base with him so that he understands what's going on, and that'll help you. He's trying to help you. There's no question. He's not trying to harm you. The fact that he referred you to me says that he's interested in getting help for you, and you should really be able to share some of the things. No, some kids don't want to do it. And the other thing is, I don't want him to be mad at me. Yes, that's something that we all feel some point in time. You know, whether our children are 5 years old or 35 years old, we all worry about our children, the emotions involved, and we certainly don't want to upset them and keep in some cases, you can upset them, they can come back to you. In some cases are tough. You upset them, they don't come back to you. Then you'll worry for the rest of your life. Where did I go wrong? What's the mistake I did? It's very important for us when you see something, say, even you can start seeing, Ved's a better expert than I am. When you start seeing some unlikely normal behavior in kids who are, if they're 12, 13 years of age, where there may be depression, maybe substance abuse issues, maybe some chronic mental illness, especially if there's any family history. And it's really important, if you have 3 children, 2 of them are okay, the middle one is not okay, it's okay to spend more time with the middle one, at least to make sure that he or she gets some help. That's very important. What happens is, in some of the families that I have known, there is too much focus on the children who are doing well. This used to happen in India many years ago, and Dr. Vasudev can vouch for that because he practiced in India and he knows a lot of people. Those children, say 30, 40 years ago, who did not do well were neglected, and the children who did well were given a lot of reasons for them to do well because they focused more on those children. And that's happened here as well. So what I'd like for people to think of is kind of just give them the same kind of love, firmness, and whatever attention they need. It's very easy for sibling rivalry, sibling jealousy. That's not uncommon at all. So once you take care of that, I think there'll be some balance there to take care of all the children. Once again, the families are worried that, you know, if I'm overly concerned or wrong, what's going to happen? Say the patient or the kid doesn't need any help, the adult doesn't need any help. I force the kid to go to the hospital, and the incidence of suicide is very high amongst teenagers. It's not just any one community, in general population, and more so now because of the increased substance abuse issues. We may think that our children are fine, we grew up differently, our values are different, our family values are different. We didn't teach them substance abuse issues. We didn't drink, we didn't smoke, we didn't use substances at home. So it's highly unlikely that they'll do it. No, we're wrong, because this starts in school. The schools are so tight-knit now that, you know, they are trying to make everybody understand that even the best of families can have problems children. So that's something that we need to be always aware, and not just feeling overconfident that I've done well, my wife has done well, our children are going to do well, this is never going to happen to my family. I think if we take that out, I think we'll look at everybody in general, and we'll be general population as well. And he has to deal with his karma or destiny. That's okay to think for our own peace, but eventually it doesn't matter. I'll tell you, I have seen a lot of family members who are so distressed about mental illness and substance abuse in children that they have absolutely no peace. You become obsessed, just wondering all the time as to what that person is doing, where that person is. You don't have a life. You just continue to worry about your child, and you want, it's like your parents. And we always worried about our parents. When I came to this country, both my parents were in India. They eventually died when I was here, but you always worry about them. You're not going to worry about your parents even if they're 100 years old. Likewise, children, spouses, you worry about them all the time. The most important thing is the sooner you diagnose, get some help, I think there'll be some peace. If you leave it for too long, if you just looking at some of the things that this slide shows, of the unwillingness to get involved, it may be a little too late. But then you end up, even if you're 75 years old, continuing to worry about your children. That's happened to a lot of our community members, and that'll continue to happen. This is not going to stop. So what we need to look to see is, we should not stop, say, because somebody is going to get angry, or my wife is not willing to help the children, or doesn't want to, because there's some concern about any of these things. It's very important for us to get involved quickly and get some professional help. However much you talk, say you have an alcoholic child or a substance abuse child, it doesn't matter how much you talk to that person. Stop drinking, stop using substances. You have to get professional help, because you as a parent can talk to them all day, but they're going to do what they're going to do. It's very important that these things are not going to just change if you keep talking to them. Even things like, okay, I'm going to cut him off. I'm not going to give him any money. I'm going to kick him out of the house. It doesn't matter, because they're going to find ways to continue to do that. The best way is to get professional help. I'm going to wait for a minute.
Shekhar, it's always a little challenge for the friends. You mentioned about the family and parents addressing these issues, but we have seen, being in the community for several years, where some of the obviously social misfits amongst the children, some of them are obviously socially misfit, and we are seeing obvious need for some help, but it's such a challenge for us to address it. Is there what is a better way, because of get both the husband and the wife together, or get the husband separately, get the wife separately, and then the child? Some of the children are older children, 35, 40 years old. So it's always a challenge. When you talk separately to them, and especially if you say something in a group, you say, oh, nothing wrong with my child. He's just a different person. He's not socially fit. Is there a better way to handle this?
Somebody said.
Go ahead.
My first belief, Dr. Vasudev, is that we need to have the parents together, because any splitting that's done between if I talk to a father separately and a mother separately, I'm going to get two different opinions. And they may never come to a point wherein they agree with each other. Obviously, you don't want to bring an adult child into the mix in the first meeting. If somebody is really, say somebody approaches you, a friend approaches you and his wife, they approach you and say, this is the problem we have with our child. I certainly wouldn't bring everybody on board, but I will talk to the parents together. And it's always important, because you may think that you want to get two separate opinions, because that'll keep changing. But if you do it together, it's a much better way of dealing with them. And I think they'll hear you more if you do it together. If you do it separately, they're going to hear what they want to hear. The wife may have a very different opinion. The husband may have a very different opinion. They're not going to collaborate together unless you talk to them together. When you talk to them together, they may go home and say, okay, this is what Dr. Vasudev said. I think there is some agreement between us. And I certainly wouldn't bring the adult son or daughter into the mix because that comes at a very late stage. First of all, they need to understand how they're going to deal with this problem. If they're not able to deal with that, bringing the third person will only complicate matters, and then there's no go. It'll just stall and just arguments and altercations. And that's when you try to persuade a substance abuse child. That's when the domestic violence thing starts. Now I have done so much research on domestic violence because I do talk to my staff all the time, because almost 30% of adults that we have in our hospital who are admitted to the hospital, there is some kind of domestic violence involved. It doesn't take much. You can throw your phone, you can break your phone, or you can push somebody, or you can throw anything that's considered domestic violence. So one has to be very careful. And if you have a child who has substance abuse issues or impulse control disorders or anger and mood issues, it doesn't take much to get involved with the domestic violence. And you call the police because you're scared that the person is going to do something. And the next thing, the police take your misfit child away from home. And then you get into the whole deal of legal issues, misdemeanors, and getting them out on bail and things like that. It's more complications for you. So anything that has to be done with regards to interventions, I would take my time, discuss. And once again, we as friends can only help so much. Some point in time, we have to get professional help. I always suggest, even when they come to me, this is what I'm looking at. I do talk to a lot of not friends, but people who I know who come to seek some help with regards to their relationships. I'm talking about a husband and wife. I always tell them, I can tell you what you need to do, but I'm not going to continue to see you to resolve this matter because you need to either do couples counseling or individual counseling. I may have gone off the road on this one. Was there more specific? It is a tough thing, but I would certainly not see them separately, and I would not bring the offspring into the mix in the first setting.
I have a question.
Sure.
Yeah. The question I have is, when I was reading the other day, the statistics still show that less a number of Asians reported. Is this because we lack reporting, or is it, in other words, my question is, are you seeing more and more of challenged individuals in the migrated Indian population?
Absolutely. Okay. The two answers to, we've had a number of immigrants. We're not just talking about Indian, Chinese, or Filipinos. We've had so many, just to give an example, we've so many Kurdish people, Somalians who come to Nashville lately. And those are the people I'm seeing more and more. In fact, I had quite a few admissions in the recent times, and their culture is very similar to ours. Somalian may be a little different, but any Asian country is very similar to ours. They want to protect as much as possible. They really do not want to bring it out in the open. But when you come to this country, there's not a lot of protection that you had when you were in your country. It's so different. It's just two of you. You fight, something happens, and you come to the hospital. You make a suicide attempt or something like that. Yes, there's been a tendency in the past to protect and not kind of expose ourselves to any kind of interference or anything like that. But because of that, I think there have been more incidences of trouble because we always try to protect, and something bad happens, next thing everything is exposed. But excellent question that it's not just us, if I mean us Indian community, but we are talking about a lot of migrants who have come to America in the recent times, especially with everything that has gone on. Absolutely. I think that has increased a lot. There's more awareness, but the communities, I'm telling you, because we've had a lot of translators who come to the hospital to translate the language, and they agree that they're seeing more and more of psychiatric issues with the smaller communities who have come to this country in the last 10, 15 years, and that is going on much more. And we've been in this country. My dad came to this country in 1959. So we've been in this country for many years, but the newer population, yes. because they still don't have the support that Dr. Vasudev was talking about, friends coming to you and asking, what kind of help can we get? So that's where our problem is. Where do you seem like you want to ask a question?
No, this whole idea of being scared to get involved because you're stuck with the problem, especially if a lady is complaining about her husband, beating her up, everybody's scared to get involved because they don't know how to take the next step, how to carry her through until the divorce, until she gets resettled and get her visa and all that. We had a couple of cases in the community that was very difficult for us to handle. Any thoughts?
That's a really tough one, but I think, I understand an immigrant who's come to this country recently really doesn't have a lot of resources, and it's only the population, general population, friends and families that can help you. I agree with you. That's a really tough situation wherein, domestic violence is so bad that that person is still in the mind thought that, nothing is going to change. This happened to me when I was living in India, and I come here now and nothing has changed. That requires a lot of, help. And it's not easy with, like if you were to seize a family member, what kind of resources do you think we can have? I'm asking you a question. This is something that anybody can answer. What kind of resources we have? Like you said, the person has to be moved. Obviously, that's the first thing. You really don't want to leave that person in a situation wherein the domestic violence continues. And we really do need to develop resources. It's not just giving somebody $500 and say, find an apartment, but there has to be there's so much going on with regards to the child pornography, the child prostitution. There's been so much help. There's so much money involved. People are pouring in money into things like that. And certainly we, as the community, and we've been leaders in the community for many years, we have to think, and obviously Temple is a good place to start, that there has to be good resources and safety net places for these people to go. That's a scary thing. You may be talking about one or two people who come out in the open to talk about it. You're not talking about hundreds of people who just keep quiet and don't do anything, just go through the misery, eventually commit suicide or attempt suicide, or just have a miserable living to a point wherein they're not even physically well. Any thoughts on what kind of resources we can have?
Shekhar, yes. Several of you probably already know that we had this community affairs committee at the temple, and we addressed this issue of domestic violences. We had fairly advanced cases of domestic violences. We had to actually take away the ladies away and put them in a hotel, and Ray helped us out. But that situation, the reason I'm bringing this up, because those issues at that time, the things came up to our committee through the temple priest. People easily went there to Gurukul and say, hey, we have this issue, and they brought up to the committee. So the reason I'm bringing this up, because several of these churches are having this sort of help there, mental health,
Yes.
where people feel they're much more at ease going to the temple priest or any other worship places, and then they direct it to the committee, and then they go to the professional. But you are absolutely right that there are numerous cases of domestic violence. We saw very severe cases, but there are minor cases are there for domestic violences. And I wish again and again, when we bring this up, and Ved knows that I bring this up, that our temple should have, we have 110 Indian psychiatrists, and wish that we have some sort of way we have in a temple where people can visit there.
It's some counseling.
It is much easier for them to get to the temple committees. Ved is just nodding his head.
So Ved's the leader, Rudra Prakash Ved and George Matthews, who was actually our Tennessee Psychiatric Association president. I think we really, now that you brought it up, it's almost, I'm ashamed to say that I've not been involved, but it's time for us to get involved. You know, when, not to say anything about the temple or the church, you know how many people rely on the churches to get jobs, to get places to stay, to get legal help, to get their children back. And that's, of course, church history goes way back in this country. But once again, I think we are a very formidable community, and there are millions of Indians who can help and afford to help. And I think just the thought process of trying to help our community, especially the younger generation who come to this country. I'm not talking about people are 30-year-olds who grew up in this country. I'm talking about 30 plus who came to this country from India on the IT or medical, whatever it is. Their culture is so different that they're shocked to see the changes. You know, you got married 6 months ago, you come, and the next thing, and the husband is doing things that you really didn't think that would happen in America. I think we really need some help and have some kind of association. And, you know, you brought up a good point. We have a lot of psychiatrists, but what are we all doing? We are not providing sufficient help for these people who are really lacking it. I can't, if I want to find a psychiatrist to go and see, it'll take me 6 to 8 weeks to get an appointment, because that's what I do. So for us to be available and do something about that would really make us feel better about it. At least you brought, it's almost, you brought up a point, and Ved and I are sitting here and wondering, why haven't we done it? I'm speaking for Ved because I know him. There are a lot of people who are well qualified who can do that. You know, we have all kinds of different specialty psychiatrists in this town, and we have to be able to do it. And domestic violence is a very major issue now. And it's so difficult for somebody to go through domestic violence issues and the trauma of that, not being able to get out of that relationship. There's nothing worse than that for anybody, leave alone an 80-year-old or an 18-year-old.
And that can be addressed at the temple level at an earlier stage, before it gets really out of hand.
I think in a church ceremony or church sermon, these things are talked about, and say they encourage people to come and talk to somebody about it, you know, whoever you feel confident to talk to. I think that may be something that we can do in our temple. I know it's not something that we want to do because we think everything is okay with us, but I think it's important for us to bring it up so that people start talking about it, so that we can be aware and we can address that. Yes, ma'am.
I think domestic violence itself, we need a different session. It
Yes,
opens up a lot of,
right.
yes,
There's a lot involved with that.
that's correct. Because while in Jacksonville, you know, I was involved with one individual who has a job, who's been married for 14 years. The husband never applied for the green card. So the young lady had a job on a some other, I don't know what that is called, the temporary basis. So when he started abusing and going out and having different issues, this lady didn't have a place to turn to. So we sent her to an immigration lawyer and see, anyway, to make the thing short, that is not one isolated situation. So I would really request Dr. Vasudev, I think we should have another complete session about the domestic violence. That is a whole taboo that nobody comes out and talks about it. But this one, to continue to ask the question about unwillingness to get involved, I was also thinking unwillingness of the individual who is affected. Is it the same as anosognosia? I mean, thinking that they are not sick. There's nothing wrong with me. I'm not sick.
Oh, you see a lot of that. That's basically lack of insight. You know, they think that, you know, when you grow up in US, it's very different, because they see a lot of the kids in school, in college, that they behave the same way, and the parents are not busting at the seams to get them help. I think it's very important to differentiate that. You know, you as a parent can talk to a son or daughter as much as you can, but they're not going to listen to you, because for them it's normal. You're just making a big deal out of this, mom. There's nothing wrong with me. That's the answer you're going to get. And it's okay. But at the same time, you know, we are at a stage wherein we are more into kind of looking at grandchildren as opposed to children, because the children have grown up enough to have their own children, And even as a grandparent, it's very important to identify, because you have more time with your grandchildren than your children do. So it's very important to identify even minor problems. Not that you need to focus on that, but if you see something obvious, I think that needs to be addressed, because your children may be too busy. But one thing I stress on, because I have seen a lot of that in the Indian community, there's a tendency for us to ignore a lot of things, thinking that it's okay, they'll get better. Oh, he's only 15, he's going to get better. But we may not see a lot of these kids come to the hospital to get help. They may be seeing outpatients and things like that. But earlier we recognize something is wrong or something is not right, something that needs help, I think it's better. And that's a stage wherein I think people will be more amenable to help, as opposed to a 25-year-old. If you see something, when a 25-year-old has problem, if you go back to his or her life and just look how they were when they were 10, 15, or 20, you can notice that there were some things that you ignored, that you didn't do anything about. The stage has now reached wherein unwillingness is the word.
I did have open seminars for the young individuals under the banner of Mother's Cry, the nonprofit organization.
Sure.
One young lady, she's about 16, she came up and spoke and she said, "Auntie, anytime I open my mouth, my mother says, I came to the country with 2 suitcases.
Yes.
I provide you with
know.
everything. And what is wrong with you? Why can't you do better? And how can the child be the best, play piano, learn Bharatanatyam, sing Carnatic music, and still be first in the class?" So I think our
Expectations. But you also have to understand, as Indians, we have very high tolerance and low expectations when it comes to other things.
Other things.
Yeah, that is, but my biggest challenge is trying to explain to people who've been in this country for 50 years and one who's been in this country for 10 years. And in the middle are caught those children who grew up in this country, they're in their 30s and 40s. So there's a big difference. And the children who grew up here may understand the culture better because they've gone through a lot. They reach a stage wherein they're stable and there's nothing wrong. And they will probably treat their children differently, knowing that what cultural change that they went through. I think it's important for us to kind of just keep that in mind.
Thank you for differentiating those 3 types of generation.
Sure. Thank you.
Thank you.
May I ask you a question?
Sure.
Hey, Shekhar, this is Rudra.
Hi, Rudra.
Listen,
I took your name a minute ago.
I just want to, first of all, disclaim that I'm not Rohan Ramachandran. This must be, this is his grandpa calling. Shekhar, compliments to you for excellent presentation.
Thank you.
And thank you, Pramodji and Ved, for orchestrating this. Shekhar, you were earlier in reference to TPA, Indian chapter, you were mentioning that you have been rather unwilling to, or you have not participated in enough. And I find it ironical that your slide is about unwillingness to get involved.
You got me there, Rudra.
But my comment in reference to your other slide was this. You remember Salman Akhtar?
Sure. Wonderful man.
Yeah, he has written a lot about immigrants. And one of the most important observations that he has is that immigration itself is a traumatic process. Umaji, you may recall this conversation. This is a fundamental thing that we as clinicians of mental health professionals, we need to keep in mind in dealing with these patients. Remember, I mean, there is scores of Afghanis that have been evacuated just imagine their lives. You can give all the physical comfort, but what they have been through and what is going to unfold in coming days and months and years. So immigration is a very, very traumatic process. The acculturation is related to that. We need to keep the cultural perspective in place in dealing with these individuals.
Just to touch on that subject, Rudra, my father came to this country in 1959, leaving 5 children and wife behind. My youngest brother was 6 months old. He didn't come back to India until 1966. He was here for 7 years. And we grew up without a father figure, with my mother and grandmother, 5 of us. Luckily for all of us, there was no trauma. We had a lot of uncles, grandparents. We lived in a big family. So I can only imagine. I'm not thinking about it. I didn't think about it then. I'm not thinking about it now. And now that you brought it up, I never saw that as trauma, but it was difficult for my mom. It was difficult for my father and the siblings. We all have done great. That's such a good point. And I'm talking about, you're talking about Afghani families. I've listened to NPR about a few people who are left behind, who helped the American embassy with translation and things like that. And the loss of family members as they were looking and as they got killed is something that they'll never be able to deal with, whether they're in Afghanistan or in US. It's all right. They got a home, they got a job, they got food to eat. They don't have to be worried about Taliban killing them. But the past trauma that they have gone through is insurmountable, and that's something they can't deal with. Thank you for bringing that up, Rudra. And immigration is such a tough subject. And of course, Salman Akhtar is probably one of the best people that you can talk to about it. But truly, that's all the changes that we have seen in the last 50 years with immigration, and all the excellent points that you all brought up about what's going on with domestic violence, how to save our young women from domestic violence, and what can be done to help them is priceless. Just to talk about it and think about it and to help them. Like I said, I plead guilty for not having gotten involved. Now that you brought up the good point, I think we can get more involved, and I'm going to talk to Wade and Ruth and George again. So thank you.
It's never too late. We welcome you.
Yes.
Can I ask a question?
Sure.
No, we know a family, the child has got a problem. Child is staying away from the parents. Parents are worried about it, and they support financially. And the child does not trust the parents, doesn't come home, or come home for one short time and goes back again. Only talks once in a while, otherwise no phone calls at all. He refuses any treatment, refuses to see a psychiatrist. Parents want to help the child, but the very intelligent child probably reads everything in Google, what this medicine will do, side effects and problems like that, as you said, and refuse to take any medicine. I will take care of myself. There's nothing wrong with me. The resistance is on the part of the child to take any treatment. How do you handle that?
Well, first of all, you might want to kind of just explore as to the reason why the child doesn't want to have a relationship with the parents. Something must have happened. As you know, it all depends on how the child was when the child was younger. There must be some ill will there from amongst the family members. A child just, especially, the one thing that you brought up a point wherein the child, they're helping him financially. If he doesn't, is there a mental illness involved, or he's just got attitude and he's somebody who's got personality issues that he doesn't want to have anything to do with the parents?
Some mental problems involved there. The one time they've taken to this, couple of times they've taken to the psychiatrist. They said a bipolar problem, and all that they said. And actually, they admitted in a Vanderbilt psychiatric floor. And
so he's had history.
Yeah. He ran away from there. Disappeared there. And the problem, the parents are worried about it, but the child completely resistant for any kind of treatment.
And
You know,
that's a
that is-
tough one, Dr. Satpathy, and it's not easy to get him into a treatment if he's not willing to do that. You know, if somebody doesn't have insight, it's very hard to get that person help. And you know, you can do everything to get that person help. The parents are obviously kind of just feel bad and they want to help him. But if he just comes once in a while and doesn't talk to them and just wants them to financially help him, I guess there's not a lot of hope. But you know, maybe I think one of the ways that I have been able to help somebody who's as resistant as this person is probably they listen to friends and other family members more than the parents. The parents are taken for granted. If you try that with a friend or even some people, some of these kids are more close to their friends' families than their own families.
No, but the
And
problem is, the problem is, you know, due to this mental problem, lost all the friends,
Oh, okay.
lost all the siblings also helping and all that. Because when sometimes they are very abusive, he will talk bad language, so they are staying away from that candidate. So neither the family nor the family or the friends, everybody is kind of isolated from the candidate, you know.
I want to see if Ved or Rudra can help me with this point.
I have a quick question about the same point.
Mhm.
Isn't there something similar to, we used to call it Baker Act in,
Yeah, we do.
do we have the same Baker Act?
Yes, I was going to come next because I have another slide. I was going to talk more about it.
Sorry,
But
I think I'm taking your
it's very
time.
important in Tennessee. It's very important. Most people don't know this. In psychiatry, the lawsuits for 6404s or involuntary commitment is more than completed suicides. So if there are 100 cases of suicide and 100 cases of involuntary commitment, there are more lawsuits against the involuntary commitment as opposed to completed suicide. You have to be very, very careful about involuntary committing. Dr. Satpathy was talking about this patient. Has he done anything dangerous? He says he doesn't want any help. Has he been physically aggressive towards people? Has he tried to hurt himself? Has he tried to hurt other people? That's the most important thing. You cannot involuntarily commit. It's okay, as long as they're a danger to themselves or other people. But it's very important to document that. You can't just say you have bipolar disorder, you don't come home, you're not taking medication, so I'm going to commit you. And you know, I've been asked so many times by friends' families, can we commit this person because he's drinking a lot and using drugs? No, it's not going to happen, because you cannot keep somebody against their will in a hospital because they're drinking a lot and using drugs. That's not, somebody may see that as a danger to themselves or other people, but the common law does not allow that for you to be a danger to yourself. You're either trying to hurt yourself, or you're psychotic, or you're trying to hurt somebody else. The reason why a lot of the psychotic patients are admitted is because of the delusions, hallucinations, paranoid thoughts. They are seen as a danger to themselves, other people. Say, Uma, you may owe me $1 million. If you don't give me the $1 million, I'm going to come and kill you. That's a delusion. So that says that person is a danger to himself or other people because of the delusion. Then you can commit the person. But you can't just take an alcoholic and say, I'm going to commit you. In Dr. Satpathy's family's case, in friend's family's case, what has he done that's dangerous? That's what we need to know. And if he's
They have not done anything dangerous, but you know, the parents, they know us, they call us, and because I'm a doctor, just they want to advise something.
Sure.
Sometimes I call to Ved and, hey, Ved, how can you help this family? Is anything? And he has seen her once or twice, I think also, but we don't know what to advise to the parents, you know?
Rudra, you have any insight on that? Maybe Rudra's. Ved, do you have any insight?
Let's finish the slides because we're running
Okay.
already.
Okay.
And some of the answers are there in the slides.
Okay. All right. So why families are reluctant? Are there any questions on this? Denial of problems with family member out of love. Need to keep the problem within the family. That's very common with us. Guilt associated with family dysfunction. You know, I always tell people, you can only be as happy as the least happy person in a family. If your child is not happy, you cannot be running around being happy, because that's not going to happen. So you can only be on level with the kid. or any family member. Loyalty and secrecy, lack of familiarity in managing the system of healthcare, lack of awareness of symptoms of mental illness. That's something, a lot of in fact, when you're younger, especially when kids start having some ADHD problems or OCD problems that can be a problem, even autistic disorders, it's very easy to dismiss this and say, I used to be like that when I was a kid. What's wrong with me? I'm great now. So if you don't have enough knowledge or know what the symptoms of mental illness are, you can ignore it to a point wherein it becomes untangible. Lack of empathy for the sick member. And I really don't want to touch too much on this. Blind faith in God and acceptance of fate. That's a very tricky one. And if anybody has any comments, I'd welcome that, because we all believe in God to a certain extent. But at some point in time, we say, maybe I should do something different. If you look at the rural population in India, there's a place called Dharmasthala in actually very close to where Ved is from, Udupi. So I have gone to the temple many times. It's a Jain temple, Manjunath Swami temple. And when I used to go there in the 70s, there hardly used to be anybody. They used to provide lunch and dinner, whoever went, and they also used to give free accommodation. My family donated a lot of money to that temple. And the last time I went was in about 2011 or 2012. You will not believe the amount of people who were coming. When was the last time you were there?
It's
Lines and lines of people. Most of the people were rural people believing that something good is going to come out of coming to Manjunath Swami temple and get rid of it. So I have done it. I continue to do it. So I don't have an opinion one way or another, but if anybody else has any opinion, but it's just a belief. It just helps you feel better. It's not that that everything is going to be fixed when you go to the temple and pray every day or every week, Sunday, but it's the faith you have to have that faith in you to change things. And that's what helps us do more than anything else. Ved, I know you have some comments on that. So
No, that's fine. Let's go ahead, because I know it's not a discussion about faith. It just adds to healing. Like you said, it has to come hand in hand with the other things that we do. Just blind faith in God, not doing anything else.
no, I agree. So this is a pretty important slide. I just want everybody to kind of just take a look at it again. So domestic violence, it's not necessary. It may be very common to have somebody, the one that you have to be most scared of, a family member. If you're looking at a family member, is somebody with substance abuse issues. Somebody who's been drinking heavily, please be very careful how you deal with that person. Do not take any action. If you believe that this person is a danger, you have to call for help, be it 911. Most times when the police come with somebody who's drunk, they're going to just take that person for 12 hours and then they'll let them out. It's not a domestic violence charge, but it's to protect. You need to get that person away from your home situation. That's the most important thing. If somebody is doing this chronically, and some people are just mean and malicious, there's nothing you can do about it. If somebody has mental illness, getting them help is the most important thing, but it's not always possible. But if you're willing, how many of my friends have called the police on their children because of their behavior, because they want to get them help. And trust me, that police presence is more fearful than anything else, and they will take care of things after that. It's not necessary that you keep calling police for everything, but if your life is in danger, if the other person's life is in danger, do not hesitate to call police. It's not necessary that one of them may be mentally ill, but it really is obvious when repeatedly things happen that there's somebody who's in the family who's mentally ill, be it the father or the mother or any family member, especially if there are a lot of children and there are a lot of fights all the time. Substance abuse issues, in my opinion, is the worst thing that can happen in a big family. That's the one thing that's more dangerous than anything else. Oh, well, even before. A friend or colleague with alcohol problems, how much can you do? I think it's interventions. I don't know too many interventions in Indian families, but I read regularly. In fact, I have a friend, Darren, who does excellent interventions with regards to substance abuse issues. He's recovering. He's done this for 10 years. In fact, I consult him sometimes to get some help. He's an expert. He'll bring a few people, he'll bring a coach, he'll bring a sponsor, he'll just intervene and get that person to a program. I think we are very careful about what our friends think of us. We don't want to in any way upset somebody. We want to keep it nice and clean. And we are a lot of times hesitant to be honest with them. You have observed, but at the same time, you want to be very nice about it. Like, I think you should cut down your drinking, so that's not going to cut it. I think it's important. I have been direct with some people about substance abuse issues, especially alcohol. For us, in our age group, I think we're not worried about cocaine or meth or anything like that. What we are worried about is alcohol. I think it's important to be direct, and just a one-on-one conversation may not always help. I would say if a spouse gets involved with the friends, the outcome is better because the fear of losing the spouse is part of the treatment. So that's very important. But, it's not easy. It takes time. It may take more than one intervention. But if there is any intervention with a group of people, I think that's going to help more. Postpartum psychosis is fairly common, and we see a lot of that. Medication is a good thing, especially when people are psychotic. And it's also important to understand that I have seen patients who had the first episode of postpartum psychosis may not have it again. But it's important to treat that. And an antidepressant certainly does help, because postpartum is a very delicate thing that a lot of women go through. In India, we had so much support that nobody kind of just gave a dime on that, but it's important here because we don't have a lot of family members. Husband having manic episodes, that's another thing. That means spending a lot of money just doing irrational things and affairs in the marriage. And I truly believe that Indian women, nothing against Indian women, I think Indian women have a lot more tolerance about these things than other country, or even I've seen Chinese people, I've seen Filipino people, I've seen Korean people, they take a stance, but we are afraid of the community. We are afraid as to what people are going to think about us. So we always kind of hesitate to take actions. But some point in time, we got to say, this is for my good and my children's good, and I'm going to do this. Especially, do not tolerate any other relationships. If that keeps happening, some point in time, you got to say, I'm going to do it. I'm going to let go. And I think some of the newer generation people are doing it, but our generation are still not doing it. I know a lot of that goes on. I talked about it earlier, dad getting dementia with agitation. That's a very tricky subject, and we can only tolerate so much. And I know a dear friend whose father had dementia and agitation. I treated him for several years, and eventually we got him to a hospital and a place wherein he died 7 years ago. So that it's very important for us to kind of just look for help. It's not in the early stages, but in later stages, when you're taking care of that person is becoming abusive to you, your children, and your wife, then it may be time to take action. You cannot try to control, because they don't have the mind to really control themselves. And medication is the way, or somewhere where there's more structured environment as opposed to just staying home. Because there's a tendency for us to tolerate a lot, saying that, oh, he's my father. What is he going to do? He's going to do a lot of things. So you got to be very careful. Son getting hospitalized against his will in a mental hospital from home, it is okay. This happens all the time. And I see a lot of the kids who come here to Nashville. I'm not talking about Indian kids. They get into some kind of trouble. It's a short stay. It's not something that's chronic, or it's not something that's going to repeatedly happen. But it's important to prevent any kind of danger to have somebody hospitalized. That's the only thing you can do. I'm sitting here, we have 121 beds, and we see a lot of patients. And every time somebody comes and says, okay, I was drunk and I'm using some drugs, I'm fine now, I gotta go. Okay, you're okay now, but what happened yesterday is what's important. Your family needs to know, they need to know how to deal with you if this happens again. Oh, my parents are in Maryland, they can't come. No, they will come when they know what's going on. So just be patient. So it's really important to prevent any kind of danger to help them. This once again, I will not hesitate to admit a friend if he says he's suicidal. I don't care how close a friend he is. If he tells me, I will talk to him. I will make sure, in a situation wherein I'm very familiar with that person, I'm familiar with the family, I may just take some precautions, but I will some point in time make an assessment. As a psychiatrist, it's different, but in general population, it's hard to make that decision, but always have the option of somebody knowing about it who can take control of that situation. It may not always be the spouse, because you don't want your spouse to go into a hospital because it was suicidal, and you don't want everybody to talk about it. That's our community, that's our thinking. So we have to be very careful about letting loose. Okay, if my husband is in danger of hurting himself, he's got to go somewhere. I think it's important to explain to the family, not just take action against the person that you're concerned about. This again, I think we have talked about some of this in the past. Your children will tell you, and it's the 16-year-old, Mom, I'm fine, you're over 18. I'm sure that 16-year-old has said this several times. These are all sentences, that we hear from the family members all the time. I can handle it on my own. I've heard that so many times that I can't handle that anymore. So I don't believe in mental health professions. A lot of them, I think the stigma has changed a lot in the last 5 years. People are more accepting, and Uma has done an excellent job of educating people. I always like to hear about you and the amount of time you're given to the community, as well as, your whole life, that you have done so much of this. I think you've done really well with regards to not only the insight, but also spreading the word that people are okay to have these problems. I don't believe in medications. We see that a lot. I'd say about 50% of patients who are depressed will stop taking medications in the first couple of months. They may say, okay, I'll take it, so I want to get out of here. I want to please my parents, but I don't have a problem. And truly, honestly, I think we don't explain to the patients enough about medications. We just say it's going to help you with your depression. We don't explain the side effects. We don't explain how long you need to be on the medication. We don't explain the interactions. And a lot of times they get frustrated. The most important thing to explain is sexual side effects. A 25-year-old is not going to have sexual side effects when they're taking medication and continue to take medication. They'll just stop it. So if you explain to them that this is something that's going to get better over the course of time, I think they'll be more willing to take medication. Once again, I have no opinion on natural remedies, and a lot of people just love smoking marijuana. They swear that helps them more than any other medication. And once again, with the newer things, Delta, there are so many new synthetic substances that I can't even make a list of that, because there's so much. Every day I see substance abuse patients, they come up with a new thing. And now the biggest challenge we have right now is marijuana is not just marijuana. It's got so much stuff that I never used to see cannabis-induced psychosis. And now it's mixed with so many things that now I have to put a diagnosis of cannabis-induced psychosis, because the only urine drug screen that's positive is cannabis, nothing else. So I just have to it truly has become significantly worse in the last few years. I need to pray more. God only can help. I'm going to have Wade talk about these things a little later.
We'll have a separate discussion on that.
Shekhar, that was very well explained, the whole thing. There are two topics that are near and dear to me. One of that is domestic violence, which I already explained, and I bring it up several times. And we have faced that issue. The second topic, which has not been really addressed too much in our community, and as our community is aging, we are seeing several of our friends having dementia,
Yes.
and it's a tough situation for the spouse. How to address this? I've not heard of any agitation and things like that, but I'm sure there is some
Oh, that's pretty common though.
that
It's
happens.
pretty common.
And we are going to see this more and more as our
Absolutely.
population is aging. And there has to be some good solution. Again, our people will not step up and say, hey, let's go and see a psychiatrist. We had to have one or two steps in between. So that's where I think our temple should play a very important part.
As
where
our population is growing older, Dr. Vasudev, I think we're going to have more cases. I think having some kind of committee or something in general, not just for domestic violence or dementia, or people who are suffering a lot because of spousal abuse, I think having something at the temple just as a committee, maybe something to look into, so that we can form subcommittees to help these people. You're so right about dementia. That's going with the aging population, we're going to have more and more cases, harder to treat, not enough space, cost too much money to put somebody in a nursing home. Not everybody can afford it. And not everybody is willing to take their parents or spouses to the hospital to get that help. I think we really need to see what kind of protocols or what kind of measures or what kind of parameters that we can have to help these people. Establishing rapport, catch them when they're alone, neutral setting, sure. I think it works in a lot of cases. And I think depending on what kind of relationship you have, whether it's a spouse, a child, a friend, it does help one-on-one. I have done a lot of one-on-one informally with friends because they've had problems with their spouses, not as a patient, but as a friend. And that's worked to a point. And they always say, we can take some of the things that you talked about, but who can we continue to see to improve that? Just having even a 15, 20-minute conversation, not necessarily bringing up all the problems they're having, but how to cope with them and what are some of the things that they like to focus on. If you're having problems with your spouse, is it about money? Is it about an affair? Is it about your substance abuse? Just stick to that and improve on that to see where they can go to get more help. Truly approach them just with normal conversations. Do not go deep into anything. Don't ask too many personal questions in the first session, because then they'll get turned off. You know me, you're asking me all these questions about my wife, so that's not a good thing. I don't think this is a good setting. Encourage them to speak freely without interruption, always. Confidential nature of the conversation. In any conversation that you have, it's important whether you're talking to a friend's family, a friend's son. I think it's very important. That's what happened with my patient. That father kept repeatedly calling me because he wanted to know what the conversation I had. I said, I just can't do that. This is HIPAA, confidential. I told your son, I'm not going to tell you, you do not want to know. And they said, no, period. Don't talk to him. That's it. And refrain from criticism and premature advice. The premature advice becomes, you see, the premature advice is given by bartenders when you go to a bar. So we don't want to be doing that. We want to just listen. And suggestions as to what can be done, because you don't want to meet that friend every week to talk about it. And you're not just talking about a friend. Most people come to you for advice. They know what to do, but they're not able to do. It's important to kind of just establish a rapport to say, hey, this is what you likely will do. And this is the best thing for you, is what they want to hear. They know what to do, but they want some kind of confirmation, reinforcement from another person who's a professional who they trust. I'm not going to go to somebody to talk about my problems if I don't trust that person. There's general feeling, oh, this guy is not trustworthy, and some people. So I'm not going to go to that person. I'm going to talk to somebody in confidence in a one-on-one setting, depending on what if I were to have a problem, I always told in the last 30 years, the one person I'd go to is George Matthews. He knows that. If I have a problem, I'll go to George Matthews. And I have done in the past. So because I trust George Matthews and I know him, I know he's somebody who's not going to talk to anybody about me. So you should have that kind of confidence. And of course, this asking permission to share concerns with others, I would just keep it to family members. I don't want to talk to Wade and then discuss that with Rudra. So that's not how it works. So.
Any other questions anybody has?
We can have an open discussion after I finish the states. What do you think, Wade?
Yeah, let's finish.
This is the last one, right?
Maybe
Okay.
still more right here.
Sure. Introducing to a mental health professional. Transfer your belief in the provider. That's something we talked about, mental health services. Sharing your experience with others.
And then transfer your trust to the professional so that he can continue to the discussion with the professional.
Yes.
That's what I was thinking.
And it's if you're psychological minded, if you believe in therapy, I think it's important for you to openly talk to a therapist. A lot of times talking to a friend is different. A therapist is definitely more objective. And a good therapist is one who's not going to tell you what to do. A good therapist is one who will give you ideas for you to think and change your life. That's my common experience. Creating positive treatment experience, privacy and confidential. People have to trust you. Anything they say, it has to be confidential. It's very important when we are seeing patients that even if the insurance companies have a lot of questions, if any legal issues are there, I think it's important to really protect substance abuse issues. That's one thing that you get a lot of lawsuits if you reveal that information without the patient documenting it. Say there are a lot of things like, addiction behavior has to be okayed by the patient for us to reveal it to somebody else. Willingness to invest in money, ongoing evaluation, absolutely, because it all depends on, there are a lot of times when you have a first episode of depression, the patient may never get depressed again. First episode, being on some medication, getting some therapy, first 12 to 18 months, you're fine and you never have any problems. I see a lot of people, and I actually consult on a recovery center. I see a lot of young 25-year-olds with severe alcohol problem, and they stopped drinking 2 years ago. You sometimes wonder, how much problem did they have to stop drinking alcohol at 22? What age did they start drinking? And those kids have done well. It's a matter of just getting some insight and say, hey, this is something that's not going to work for me. But that won't happen with everybody. I'd say about 5 to 10% of the patients may have enough insight to even make an attempt. Dr. Biliar can tell you, our experience is when our patients come, this is their 10th treatment, a 12th treatment, a 13th legal problem. So my challenge more than anything, more than mental illness, now in 2021 is substance abuse issues. People are getting into a lot of legal trouble, domestic violence issues, mental health issues, suicides, a lot of deaths. The OxyContin deal, the heroin deal, the fentanyl deal. A schizophrenic is less likely to commit suicide than a substance abuser. A bipolar disorder patient may be on par with a substance abuser, but the likelihood of substance abuse, if you took 25 substance abuse patients and 25 bipolar patients, the likelihood of the group of 25 substance abusers is much higher than the bipolar patients. A treatment plan is always client-centered. We just have to look to see every treatment is individualized these days. It's not like specific, all schizophrenics are treated this way and all substance abusers are treated this way. Every patient is different. And when we do our treatment team meetings in the morning, we talk about every patient. And the first thing we want to talk about is the treatment plan. What are we doing for this patient? Is this patient somebody who's going to go to therapy? No. So let's skip the therapy part because let's not waste time. Medication. Is the patient going to take medication? No. Let's give him a monthly shot to make sure that there's medication in the body. We have lots of levels of help available. Self-help, in some of the cases, in fact, self-help groups, especially for alcoholism, That's probably the best thing. And a lot of people believe in AA meetings as well as AA books, and that's really important for us to kind of encourage patients to do. There are so many new things. And unfortunately, what's happened lately, at least since COVID started, people are not able to see their therapist live. It's almost always online or on the phone. And that's becoming very difficult for patients who have a lot of problems, because you get so much out of it when you see a person to person, as opposed to on the phone or on web. Because just body movements, the restlessness, just looking elsewhere, those are the things that the therapists observe, and they can give them some guidance. But hopefully, at least in the next couple of years, when COVID decreases or to a point wherein we all get used to the idea of just living with COVID, I think things will get better. Spiritual, I've always believed in that, and there are a lot of things. And one of the things that I forgot to mention, I don't know if Ved, you saw that, I think I did some yoga in the beginning. It went well. I somehow dropped out. A lot of people swear meditation and yoga is something that they can do and get it. I mean, we have known people from India doing this forever and doing so well in life, not worrying about meditation. The trance-like state. You go do yoga, go to meditation, you know nothing. There are a lot of people who forget about everything. Life is different for them. Hopefully, we can encourage more of that. And we have licensed professionals as well as psychoanalysts. Psychoanalysts are far and few now, just because, it's mostly in the Northeast. There are very few, and there are very few patients who have the kind of money to spend. This is very important. I'm just going to focus on this slide. The most important thing for involuntary treatment is danger to self or others. If I believe that a patient is going to hurt himself or other people, I think it's very important to put that person in a hospital. It doesn't matter if it's 1 day, 2 days. A lot of people, if it doesn't involve chronic mental illness, chronic suicidality, chronic substance abuse issues, they can be treated quickly with medication, decrease their aggression, calm them down, and can be discharged to a safe place. But do not hesitate. Once again, common public, do not hesitate to make sure if there is enough evidence that a person is going to do some harm, we can commit them. Once again, danger to oneself, others. Serious mental illness, any kind of agitation, hallucinations, paranoid thoughts, very highly repeated ritualistic religious beliefs. You see a lot of people in the streets of Nashville, chronic schizophrenics, who are just walking around or just in the corners begging for money. They may have a lot of delusions, but they may not be a danger to themselves. But if they believe that you owe them money and they're coming after you, those are the ones who are dangerous. So there are varieties of people who may not be a danger to self or other people, but anytime, like substantial likelihood to immediate harm. And please always be careful about dealing with alcoholics. They are more dangerous than any other substance users. And out of touch with reality, we're talking about schizophrenics, a bipolar disorder with psychotic features, a schizoaffective disorder. We have talked about this. You cannot watch somebody who's suicidal, immediately call for help. Bodily harm, do not hesitate. Delusional thing, I mean, I've repeatedly talked about it. When you suspect, elder abuse is very important. That's a topic that's becoming more and more popular. You have adult protective services, all child protective services, and Dr. Billiard is much more of an expert than I am. So these are things to be considered. I think we have covered a lot. There are a lot of the slides that I show that could be a whole session, especially involuntary commitment and domestic violence. I think dementia is another thing. I think Pramod brought up some excellent points as to what we can do to help our community. Especially, I think people are more aware the temple is doing a lot of things, and these lectures are giving people hope that they can kind of just talking about it and just thinking that this is what we do. I think there's always hesitation. If somebody says, and the discussions that we've had and what we can do and what we should do, I think it does help people to feel more comfortable coming to get help. So, I'm very careful about involuntary commitments, but most patients I see will need. I have sent few people home when I've talked. If I believe that a patient is okay, or a person is okay, I will talk to the families and see how responsible they are. Are they able to take care of the patients? And I always tell them, if there's any hesitation at all, do not hesitate. If there's any problem at all, do not hesitate to call the police so that they can come and get an evaluation. Involuntary admission is very common in this country. At the same time, one has to be very careful. Do not admit them unless you have enough evidence and there's enough documentation that they've either done something dangerous in the past or continuing to think dangerously, or likelihood of doing it again. More than 50% of involuntary admissions, when they come to the hospital, they're very hesitant. And once they come to the floor, hospitalization, there's some insight, because all the external factors, especially the stresses that they have outside, are gone. They're actually in the hospital and they have a little more different perspective. They've had time to think, what did I do? What made me come here? Why did I hit my wife when I was drinking? There's some regret. There's some insight. You can expect some changes. I think it's important to just let them stay for a few days and then have conversations with the family openly, and explain to the family that they're not going to be able to hurt you because they're here. If they make any threats this evening from the hospital phone, please let us know so that we can address it next morning. It's very important to get them through the crisis safely. Safety is the number one thing, whether be a spouse, anybody. If you believe that that person is unsafe, they have to be removed from that place, because then they become dangerous. And the other thing is, if you tolerate bad behavior, that's going to continue because they'll take it for granted. The behavior is reinforced. So it's very important to cut it. And if, like Dr. Satpathy was saying, if your child, your spouse, your parent, somebody is acting out, it's okay to cut that person out and wait for that person to get better before you bring that person back to life, your life. You know, it's kind of hard to educate yourself, but I think there is so much more awareness. Don't believe everything Google has, but mental illness can be helped. And, you know, we've always talked about being judgmental about, especially in India, even here, about mental health suffering. I'll give you an example. Our ER has a lot of a lot of mental health patients who come there. Sometimes there are more in our ER waiting for psychiatric evaluations than medical evaluations. There was a time, say about 10, 15 years ago, at Skyline Medical Center, they didn't really worry about having psychiatric patients. Oh, psychiatric patient, let's give some medicine and get them out of here. Now we have a unit in the emergency room which has 8 beds that we can house them for up to 3 to 5 days, and then they're placed appropriately. So things have changed a lot. They're less judgmental, they get more help and immediate help. So we have done an excellent job, at least our hospital, and a lot of the other hospitals are following as well. So.
That's it.
Thank you.
That's an excellent talk.
Thank you, Dr. Vasudev.
Is there any other?
Yeah, Shekhar, that was excellent talk.
Thank you.
I want to ask you, a patient comes with insomnia due to anxiety and depression.
Yes.
What non-addictive medication do you recommend?
That's an excellent question, Venkat, because a lot of times there's a tendency to just put them on benzos, and they may be drinking, they may be using substances. There are several that you can use. And one of the things that I like is Remeron, if the patient doesn't have major medical issues. Remeron does work well at 7.5. The higher you go up, the less sleep they're likely to have. And doxepin is a very old medication. A lot of people don't use it because of cardiac side effects. 10 to 25 milligrams really does help. And I don't have too much experience on Belsambra, but I'm told a lot of the insurance companies do not kind of okay that, so there's a problem. And if that person doesn't have a lot of metabolic syndrome issues, and you're a ER physician, I think small doses of Seroquel really does help. And it does help to a point wherein the mood is definitely better.
Shekhar, apathy is not truly a mental issue.
Absolutely,
But,
yes.
Absolutely. Apathy, but we have noticed this in our sessions we do every month.
Mm-hmm.
For some reason, we bring some great speakers, like today's talk, for example, we have only 12 or 13 participants, and we send out flyers to about 600 people.
I didn't realize where you're going with this.
Is it our community that's a problem? Because I tell you, I gave this longevity strategy to the BMM. This is Brahan Maharashtra Mandal. It's a Maharashtra Mandal national organization. 120 people were participating live, and another 100 were on the waiting list. So I don't know what can we do to our community.
Do you have a better population for medical?
No, same issues. The max we had was for 43, 44 for supplemental medications and for orthopedic.
Oh, okay.
Now, when we used to have the live sessions,
yes, that's what I was going.
Before the COVID,
yes,
we used to say in the live session, we are going to serve some food at the end of the meal. We used to get 70, 75 people come to the library, sometimes travel 34 miles, but they like that personal touch.
Yes. Yeah, I think that works a lot better. You're right. So, and I think you're limiting it to an hour, so that generally helps, because people lose attention after an hour, and depending on how much interested they are, and this is an excellent topic, truly, and I think the next time maybe we can have more of a informal discussion with regards to some, like if you were to do a topic on dementia or domestic violence, I think people will talk more. If you have just specific domestic violence or dementia, I think there'll be more participation. I truly believe.
One question here. It may be foolish question, not fair question. But what is the average course of this bipolar and CD or paranoid, or what is the natural course of the disease?
Generally, bipolar disorder in adults starts around 18 to 22. And schizophrenia is around the same time. I have seen bipolar patients with manic episodes at age 60, depending on how much medications they take. If it's associated with substance abuse, the prognosis is very poor. Schizophrenia prognosis is 1% of all population has schizophrenia. Now they have changed the bipolar disorder. It used to be about 1.5. Now they made it about 3 to 4% because they include a lot of other illnesses with bipolar disorder, like ADHD, personality disorders, impulse control disorders, substance-induced mood disorders. So if you bring a group of people into the same diagnostic criteria, then it becomes higher. They both attempt suicide the same way. Schizophrenics tend to live longer because they're chronically psychotic to a point where they're not thinking too much, especially those people who do not have command hallucinations are telling them to hurt themselves. But bipolar disorder patients, it's difficult because they have the manic episodes and the depressive episodes. When they have the manic episode, they're doing well, and they're not going to do anything to hurt themselves, but do a lot of irrational things, which may lead to them hurting themselves. But they've had so many manic episodes, when they come to a point wherein they're really depressed, that's when they attempt suicide and succeed. The most common way, and at least in this country, is shooting themselves. Hanging is probably not that common, but what I see is most commonly is overdose. And if it's associated with any substance abuse issues, the likelihood of them dying is higher. So I would say schizophrenics, I see schizophrenics commonly who are 50, 55 years old, who've had schizophrenia for 40 years, but they probably tend to kind of more calm when they're later stage, but bipolar is much more unpredictable. They can be the same way throughout their lifetime, and medication really does decrease. The bipolar patients have tendency to be more compliant with medication as opposed to schizophrenics, because schizophrenics, when the hallucinations and delusions go away, they think they are okay, and then they stop taking medications. But bipolar patients do know that they can become depressed if they stop the medication, or they can become manic. So the compliance is a little more, and general population, bipolar is a better educated, probably have a better living, better family support as opposed to schizophrenics.
And that was an excellent topic. We really enjoyed, Shekhar. And I
Thank you.
wish we can give it again where we have more people can join us. And by the way, this topic has been recorded,
Thank you.
and the recording comes out very clear.
Is that right?
If your friends or family wants to listen to this, please send me an email and I'll forward that to you all. Again, thanks, and I'm going to end this session.
May I just say one thing?
Oh, sorry. Go ahead.
Rudra calling.
Yeah, go ahead.
Just saying thank you for having this session, because 10th of October is World Mental Health Day.
Right.
And starting from this Monday is going to be Mental Health Week, Awareness Week. So this is very fitting contribution from you, Shekhar.
Thank you.
And thank you again, Pramodji and Ved, for arranging this seminar.
Okay,
And
thanks. Thanks.
I really appreciated everybody's participation and excellent questions. And I've done psychiatry for a very long time. It's always good to hear newer questions and to come up with answers. It's gold. So.
Thanks again. And I'm going to just end this session again.
Thank you.
Mhm.
Thank you.